Hey everybody, this is Drew, the Knee Pain Magician. So if you're unfamiliar with my channel, I specialize in helping active women over the age of 50 solve their chronic knee pain so that they could get back to enjoying their favorite activities without having to rely on further use of injections and possibly surgery. So in this week's video, we're going to be addressing medial knee pain. That means pain on the inside of your knee. So if that describes the situation you're dealing with, stay tuned because I'm going to show you 3 of my favorite exercises to help you find lasting relief. Before I dive into what those exercises are, I'd like to step back and kind of help you think big picture why it's important to understand where exactly you're struggling with pain and what your pain feels like. So as an example, every week I speak with dozens of women who are struggling with chronic knee pain, and many of which would describe having a dull ache or a deep throbbing pain, or maybe there's tenderness and the knee itself is swollen. Usually when someone describes having a knee situation like that, I wouldn't recommend working the knee itself. Instead, maybe we would start by working on the joint below and above the knee, which would be working on the foot and the ankle and the hip, because oftentimes working those areas can provide a lot of relief to the knee itself. But that's not what we're going to be working on today. We're going to be working on solving inside or medial knee pain. This is having pain or a problem in one specific area of your knee. And the reason why it's important to think about where you're having the pain and what it feels like is because it gives me some more clues to think about what may be helpful to you to find a solution. So assuming that you do have inside or medial knee pain, we're going to be working on 3 specific areas that are often associated with providing relief. Number 1, we're going to be doing an exercise called a toe pull. And the toe pull is going to be really helpful because it provides relief to the ankle, mobilizing a joint within the ankle that connects the ankle bone to the shin bone. If you have an issue with your knee, oftentimes it's related to a lack of mobility within the ankle itself. So we're going to be working on that ankle. So that's going to allow the bones connected to your knee to move a little bit better, which can often provide relief. After we work on the ankle, we're going to be working on the elbow. The elbow is important because it's called the opposing joint. So oftentimes, instead of working on where you're having the problem, you want to think about what other joint is connected on the opposite side of my body to that area. So your knee and your elbows are actually connected. So rather than working on your knee, we're going to be working on a nerve that innervates the inside of your elbow. It's called your ulnar nerve, because working that nerve can often provide relief to the inside of your knee. Who would have thought? However, it does work. Last but not least, we're going to go to where you're having problems, and we're going to be working a nerve that runs down the inside of the knee. It's called your saphenous nerve. Oftentimes, problems just come from the nerves not working as well as they could be. So when you kind of move your body in specific areas, depending on where your problem is, you can kind of unlock some tension, and that can allow you to feel and move better. So those are 3 areas we're going to be working on, again, to help you address and solve medial knee pain. So before we go through our 3 exercises, the first thing we need to do is check in and see how your knee is currently feeling. The reason why we're doing a test or assessment is for you to see what is actually helping you. So we need to test your knee both before and after we do an exercise in order for us to find the best exercise for you and to make sure we're not making you worse. So what do I mean by this? Well, there's a couple different things you can do to kind of like check in and see how your knee is feeling. So when do you feel your knee pain? Is it when you're walking through your home, going down a hallway? Is that when you feel that medial or inside knee pain? Maybe walking isn't enough for you to trigger your pain, and you need to be able to squat or kind of bend down, sit down into your chair, come up out of your couch in order for you to feel that chronic pain that you're having on the inside of your knee. Or maybe both of those are a little bit beyond you at the moment, and just sitting down and bending and extending your knee is enough for you to kind of like trigger that medial knee pain. So whatever it is, I just want you to kind of give it a ranking. So on a scale of 1 to 10, 10 being a high level of pain, stiffness, discomfort, 1 being you feel amazing, kind of where are you in the moment? So don't worry about what other people may think your number is, just think about how are you feeling. Again, doesn't need to be super scientific, but just kind of a little bit of a label so we can compare after we do the exercise of what's actually helping you improve. So once you've done that, I'm kind of taking stock of how your knee is feeling right in this moment. You could write it down or just keep it in your brain. What we're going to be doing is starting with our first exercise. This is called a medial toe pull. So today's video, we're going to be demonstrating on or trying to solve pain on the left knee. So if you have an issue with the right knee, you would do the opposite leg. So with that medial toe pull, we're going to be working the inside of that left ankle. So I'm going to move the camera just to give you a better view. So for this medial or inside knee pain, we're going to be working right here on the inside of that ankle. So I want you to think that these two areas are connected. So we want to gently open up this area to provide some relief here. So if you're at home, this is going to be something that you want to add a cushion or a blanket, something to provide a little bit of support and cushion underneath your toes. Otherwise, it could be a little bit difficult, especially if you're dealing with a hard surface. So you could do this sitting down. I'm going to do this standing up, and I'm going to be standing on my right leg, which is the good leg. I'm going to take my bad leg, right? I've got the inside knee pain on my left leg, and I'm going to take it straight back behind me. So notice as I pull my leg backwards, I kind of flare my leg and my hip. So now my knee, my foot is kind of directed towards the outside of the room, left side of the room. And maybe I step forward a little bit more with my right leg. So as I'm doing this, I'm opening up the inside of my left ankle, and I already kind of feel like a bit of a stretch from the inside of my ankle up through the inside of my knee, all the way through the inside of that left hip. So if you have a cushion at home, you're going to put that right underneath your toes, right? Maybe your toes are going behind you or going out to the side. Doesn't make a huge difference, kind of depending on what your comfort is. But do use a cushion so you could have a little bit more support. So from here, this is your starting position. What I want you to do is imagine that you're going to draw or bring your left ankle bone towards the ground. So I'm trying to pull the inside of my left ankle towards the ground. And this is just a very subtle motion. Notice I'm not moving my whole body. I'm just literally moving that ankle. And as I'm pulling, stretching the inside of that left ankle, I feel a stretch all the way up deeply within that left knee and all the way up to my left groin. So I'm going to zoom in so you could get a little bit better shot. Okay, so here we are zoomed in so you get a bit of a better view. Just pay attention to my ankle. I'm not moving my whole leg, I'm not moving my whole body. I'm just focused on imagining I'm bringing the inside of my left ankle towards the ground. Obviously, I'm not going to be able to do that, but just getting like a quarter inch, a half inch of movement can really be enough to open up that ankle, which opens up the inside of that knee joint. So if you see me from this angle, it looks like this. Maybe do 10 reps on the inside of that ankle. Again, don't move into pain. Make sure it's a comfortable movement, but do 10 reps just to make sure that you're opening up and you're doing the technique right. Okay, so after you've done your toe pulls, what I want you to do is reassess. Stand up, go for a walk, try your squats, bend and extend your knee. Do whatever you did earlier where you felt like, oh yeah, that's where I have my medial knee pain. I want you to go back, replicate that movement, test it out again, and see, is your knee feeling a little bit better now after we mobilize the inside of your ankle? So once you've done that, if that helps, great, write it down. If not, don't worry about it. We're going to move on. We still got 2 other exercises that are really powerful and can likely help you. So second exercise we're going to be working on is called the ulnar nerve glide. Ulnar nerve, U-L-N-A-R. So again, we're going to be dealing with the opposing joint. So assuming you've got that medial knee pain on the left knee, we're going to be working on the opposing joint, which is the right elbow. We're not actually going to be working the joint itself in this particular video, but we're going to be working the nerve that controls and innervates the inside of that joint. So if you watch me, what I'm going to be doing, got good posture. Whether I'm sitting down or standing up, my spine is long. I'm going to bring my wrist up. I'm going to bend my elbow. I'm going to bring my elbow towards the front of my shoulder, not outside, not below, but right in front of my right shoulder. So if you pay attention to my palm, it's kind of like I'm a waiter and I've got a plate of food on the top of my palm. So I don't want to dump that plate, so I got to make sure that I've got that good posture, good technique here. So from here, what I'm going to do is gently rotate my elbow towards the side of the room. And then I'm going to bring my elbow back. Rotate out to the side, come back to center. Rotate out, come back to center. So what you should be feeling through your pinky all the way down your forearm to the inside of the elbow is a little bit of an electrical sensation, kind of a nervy feeling, a little bit of a burn. If you don't feel that, you could do a little bit of skin stimulation, kind of help improve that brain-body connection. It's like, oh yeah, okay, that's the area I'm supposed to feel, supposed to work on. You're going to come back into this position. I want you to go back out. Make sure you're keeping your wrist extended back like this, right? And I want you to do about 5 repetitions. On the 5th repetition, what I want you to do is imagine that you're drawing a circle with your elbow. Clockwise circles. Going in front of my shoulder, above my shoulder, behind my shoulder, below. Drawing a circle with my elbow around my shoulder. 5 circles one direction, 5 circles the other direction. Right? Very simple. The whole time I'm doing this, I could feel that nervy sensation, that ulnar nerve. I feel it stretching and getting activated. So again, remember, you've got one big nerve in your body, spinal cord, and then it goes out through your arms and your legs. So what happens on the right arm impacts what goes down that left leg. So I just want you to kind of make that connection. After you do that exercise, you're going to stand up, reassess, go for a walk, try your squats, bend and extend your knee. How does that feel? Go back and try to replicate where you usually feel that inside knee pain, the stiffness, whatever symptom you're dealing with, and think, okay, now that I'm mobilized the nerve on the inside of my elbow, opposite joint of my body, how does the inside of my knee feel? Do I have less stiffness, less pain, an improved range of motion, better movement as you're walking? Those are the things we're looking for. If that exercise was helpful, take a note, write it down. It's called the ulnar nerve glide. And you could save that, get a sip of water. We're going to be working on our 3rd exercise now. Okay, for our last and final exercise, now we're actually going to be working on where you're having your pain. So notice how we started. We started with the joint below where you're having your symptoms. Then we worked on the joint on the opposite side of your body that correlates, that connects to where you're having your issues. And then lastly, we work on where you're having pain. So we don't want to start with the problem. Oftentimes we want to work on other areas that are important and connected to in order for your brain and your nervous system to feel a little bit better about where you're having the problem. And then finally, last but not least, we want to maybe gently work the area where you're having your issue in the hopes that it's kind of more prepared for movement. So this is called your saphenous nerve glide. The saphenous nerve controls and innervates the inside of the thigh and the knee. So we're going to be working this area, moving your body in a specific way in order to provide a little bit of tension on that nerve in hopes that it kind of unlocks and provides a little bit better communication that's going to help you hopefully feel and move better. So for this one, it's a little bit complicated and technical setup, but just kind of do your best and follow me at home. So I'm going to be standing up nice and tall. I'm going to take a big step out to the right side. So from here, I already feel a bit of a stretch through the left thigh. And what I want to do is I want to orient my left leg and foot towards the left side of the room. Yeah. So as I do that, it kind of pulls my hips towards the left side of the room. So I want you to put your hands on your hips and pull your belt buckle, right, your belt line towards 12 o'clock. So as soon as I do that, I already begin to feel the stretch down the inside of my left thigh. So I am bending my right knee. So maybe I've got like 60% of my weight on this right leg, 40% on this back leg. And from here, you should already begin to feel a bit of a stretch through the front of the left thigh, down through, hopefully, the knee itself. From here, what I'd like you to do is put your hands on your pelvis, and I want you to think about rotating your hips, rotating your pelvis. Top of the hips move forward, top of the hips move backwards. When the top of the hips move forward, that's called an anterior pelvic tilt. When the top of your hips move backwards, that's called a posterior pelvic tilt. So as I rotate the top of my hips backwards, I'm kind of tucking my butt. And as soon as I do that, I feel, oh wow, that's a much deeper stretch down the front of my thigh and groin through the knee, inside of the knee. As I put my hands back on my hips and I roll the top of my pelvis forward, I do the anterior pelvic tilt. I untuck my butt, kind of arch my back. The stretch kind of decreases, it goes away. As I tuck my butt, drive my hips backwards, feel the stretch. As I release and arch my lower back, the stretch goes away. So I just want you to kind of mobilize and get this brain-body connection for moving your pelvis, gently rotating it backwards, gently rotating it forwards. This movement in and of itself can provide a lot of relief to the inside of that left thigh, inside of that left knee. After you do that, that could be fairly intense, even for myself, so I just want you to shake it out. Then you're gonna go and reassess and then come back. So for the second part of this exercise, you gotta get back into that position. So I've got my left leg back, right leg forward. My left foot is kind of pointing towards the left side of the room. I'm gonna pull my hips back towards 12 o'clock. I'm gonna tuck my butt. Now, I'm not gonna worry about the pelvis, but I'm gonna think about my left foot. So now with my left foot, what I'm gonna do is raise the outside of my left foot, and then I'm gonna replant my foot. Raise the outside of my left foot, and then replant the foot. So inside of the ankle comes towards the ground, and then the outside of the ankle goes flat. So somewhat similar to the exercise we did earlier, and that you're trying to bring the inside of your ankle towards the ground. As I do this, it's called an ankle tilt. As I tilt my ankle, I get a much deeper stretch through the inside of the knee all the way up through the groin. And then when I plant my foot and it's flat on the floor, the stretch goes away. Through the movement, I'm keeping my butt tucked, keeping that posterior pelvic tilt. It's kind of locking in that stretch through the inside of that thigh. Again, isolating my ankle, only moving my ankle through this position. Flat foot, ankle tilt, flat foot, ankle tilt. And making sure that my hips don't kind of lose their orientation. As I begin to kind of drift out to the side, I kind of lose this setup and I don't get the same stretch and stretch within the nerve itself. So I got to make sure that my hips are oriented towards 12, tucking my butt, keeping my leg pretty stiff. Knee isn't bent, only the opposite is. And then I'm just doing these ankle tilts. Not moving the rest of my body, just moving my ankle. And then I want you to shake it out. Shake out that area. Once you finish your saphenous nerve glide by working the hips and the pelvis and by working the ankle, what I'd like you to do is go and reassess. Go for another walk in your home, try a few squats, bend and extend your knee, go up and down the stairs. Do what any movement or assessment you need to do in order to get a better sense, how does the inside of your knee feel? So after you've reassessed, I want you to think about how helpful that particular exercise was for your knee. If that provided immediate relief in pain and stiffness, then that's a great exercise you want to write down, saphenous nerve glide. If it didn't, maybe it provided you with more stiffness or more pain, and when you were walking, you didn't feel quite as good as you did with some of the other exercises earlier. Maybe that would not be an exercise you really want to prioritize now. Maybe in the future you come back to it, but at the moment I would focus on the other exercises that help you the most. Okay, so wrapping up for this week's video on medial or inside knee pain. So today we worked on 3 specific exercises on 3 distinct areas of your body that I often use to help with women who are struggling with inside knee pain. So hopefully you found this week's video helpful. If you did, I always appreciate your support. If you could, click the like button below and subscribe to my channel. Your support is always amazing. In addition to that, if you're an active woman over the age of 50, and you've been struggling with chronic knee pain for quite some time, maybe you've tried physical therapy, at-home stretching and strengthening exercises, various injections. Maybe you've got a little bit of relief, but nothing that's been like really deep and long lasting. I encourage you to watch my masterclass on overcoming knee pain. You can find a link to that at the bottom of this video and at my home screen. So that's it for me this week. I look forward to reading your comments in the comment section and talk to you soon. Bye-bye.